So today I want to talk to you about peptide therapy and really the role of the GLP-1 and some other common peptides, really how they're used in modern medicine. So, peptide therapy has really gained significant attention in recent years. It's revolutionizing the way we really approach various health conditions and really how we manage them. Now, peptides, which are really just short chains of amino acids, they are linked really by a peptide bond, and they really play a fundamental role in numerous biological processes, from regulating metabolism and growth to tissue repair, our immune system. These peptides are really essential in really maintaining our body's optimal function. Now, in medicine, their synthetic or bioengineered peptides are really becoming increasingly used as therapeutic agents to really target specific diseases. They offer advantages over traditional small molecule drugs. So we're going to explore some of these peptide therapies and really focus on the glucagon-like peptide 1 or the GLP-1 and talk more about benefits, risk, and really future potential. So first, what is a peptide? Well, peptide are natural occurring molecules that consist of two or more amino acids. They're linked together, like I said, with a peptide bond. They are the building blocks of proteins and are really integral to numerous physiological processes. Now, in the body, peptides function as hormones, enzymes, and neurotransmitters. They play roles in processes such as metabolism, your immune response, cell signaling, and tissue repair. Now, peptides can vary in size from small chains of just two amino acids, dipeptides, to much longer chains, which are called polypeptides or proteins. Their complexity and specificity make them suitable for targeting certain cellular pathways in a way that traditional drugs really can't do. Now, in therapeutic context, peptides can be synthesized in laboratories and used to mimic or enhance the effect of the natural occurring peptides. These therapies are often tailored to target specific conditions with greater precision than really the other forms of treatment. So common peptides in modern medicine. Now, peptides have become integral really to modern therapies, addressing a wide range of conditions. So let's talk about some of these and how their treatment is. So first off, insulin. One of the most important peptides in medicine is insulin. This regulates glucose levels in our body. Now, synthetic insulin is used extensively to manage diabetes. It mimics the body's natural insulin, helping to lower blood glucose levels in patients with diabetes, particularly type 1 and 2. So the benefits, obviously, you're controlling blood sugar, preventing hyperglycemia, and diabetic-related complications. The risk, obviously, is hypoglycemia or low blood sugar if they're administered improperly. They can also lead to weight gain and possible insulin resistance. Another peptide is the body protection compound 157 or BPC-157. This is a peptide with powerful regeneration properties. So particularly it helps in healing of injuries. It promotes the healing of tendons, ligaments, and muscles by stimulating angiogenesis, which is the formation of new blood vessels. It reduces inflammation and really improves tissue regeneration. So obviously the benefit is it really accelerates healing. It reduces inflammation, enhances muscle and joint recovery, and promotes tissue repair. The risk, though, is there's really limited long-term human studies. And so it's really it's one that we don't know what the long-term outcomes may be. Another one is thymosin beta 4. This peptide involved in tissue repair and regeneration. It plays a key role in wound healing, reducing inflammation, promoting the growth of new tissue. So again, its benefit, again, is accelerating wound healing, reduction of inflammation, and supporting muscle tissue recovery. Problem is, it's possible immune system modulation that could really cause some severe adverse effects with autoimmune type patients. Another one is CJC-1295. Now, this is a synthetic peptide that stimulates growth hormone release. It is often used in anti-aging and muscle building therapies due to its ability to really boost muscle mass, improve fat loss, and enhance skin quality. So obviously the benefits are increased muscle mass, reduction in body fat, improved skin elasticity, and really promotes anti-aging effects. However, the downside is potential for fluid retention, joint pain, and an increased risk of diabetes. Now, the one that we all hear about today is the GLP-1 peptide, so I want to talk about that. It's one of the most well-researched and widely widely used peptides in modern medicine. It's used to manage type 2 diabetes and obesity. It plays a significant role in metabolic health, and its therapeutic potential really does extend beyond just glucose regulation. So what is the GLP-1? Well, it's a hormone that's secreted by the intestine in response to food intake. It really helps regulate blood sugar by stimulating insulin secretion when blood glucose levels are high. It inhibits glucagon secretion, which prevents the liver from producing excess glucose. It slows the gastric emptying, which increases our feeling of fullness. And really, it promotes satiety to reduce our appetite. So GLP-1s, how they work is really they mimic the action of the GLP normal hormone. It's going to help improve insulin secretion and reduce blood sugar. So again, it's going to improve your blood sugar, improve glycemic control, weight loss, and has a cardiovascular protection. However, there is risk with this. There's gastrointestinal side effects, nausea, vomiting, diarrhea. It can cause pancreatitis. Thyroid tumors have been noted in animal studies, and obviously potentially can cause you to become hypoglycemic when combined with some other drugs. Now, where we're seeing this used a lot in the media now is really in obesity and weight loss. So again, it's used to help treat obesity. Your medicines like semaglutide does show significant weight loss in people that use this. Now, again, it works by reducing your appetite, slowing your gastric emptying, and really promoting that feeling of fullness. So again, there is benefits of substantial weight loss. The risk, though, is just like I said before, all the risk associated with it we talked about with diabetes, but also there's additional concerns regarding the gastrointestinal discomfort or possible side effects. And another significant risk is there is significant muscle mass loss in using this. So people lose a lot of weight with this, but they're also losing a lot of muscle mass, which is very detrimental to the long-term health. Now, research has shown that the GLP-1 receptor agonists reduce the risk of major cardiovascular disease events in individuals with type 2 diabetes. So it's showing promise for its cardiovascular protection. But it's really simple. If you're managing your diabetes better, you're going to reduce the risk of those things. So again, the benefit of risk reduction in heart disease, strokes, cardiovascular death. But again, there's still all those potential side effects that we've already talked about. So what's the future hold? Well, peptide therapy has the potential to really revolutionize modern medicine, offering targeted treatments for a variety of health conditions, from managing diabetes and obesity to promoting tissue regeneration, combating the effects of aging. Peptides like the GLP-1, they're really at the forefront of these advancements. So, peptides are really becoming essential in personalized medicine, offering treatment tailored to specific needs of the individual patient. Their ability to target precise biologic pathways make them highly effective in managing conditions that have traditionally been difficult to treat. So what are some of the challenges and opportunities? Well, while peptides therapy does hold great promise, there are challenges that must be addressed. First, the cost and accessibility. Peptides therapy is extremely expensive, so it's very much cost prohibitive. Also, regulation and standardization. Stricter regulations are necessary to ensure the quality and safety of these peptides. And then long-term safety data. There's just really needs to be more research done to really understand what the long-term effects of these peptides are. You really, particularly when we're using them for non-medical purposes like anti-aging. So the future of the peptides does look bright, with new peptides being developed for really a wide range of applications, from improving your metabolic health and enhancing regenerative capabilities to really addressing cardiovascular disease and neurodegenerative conditions. Peptides offer a promising avenue of improving health and extending life expectancy. As the field of peptide therapy continues to evolve, we can expect even more targeted and effective treatments in the years to come. However, along those lines, we also have a lot more to learn on the long-term consequences of these things. So it's one of these things that's up and coming, but we also need to pay attention to what is the risk, what's the benefits, and more studies in looking at potential poor outcomes. So again, I wanted to touch base on this because we're seeing this all over the media and help give you a little more insight in that. And if there's anything we can do really on your health and wellness journey, just let us know. Thanks.